Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions to both their acute and chronic medical needs. We do this via our telemedicine program, concierge medicine program, primary care, COVID-19 testing, as well as COVID-19 vaccines. In addition to this, ladies and gentlemen, we do it with our brand new Amazon best-selling book, Vitality, and through our House Calls 42 segment on CBS 42 News every Monday. So good afternoon, ladies and gentlemen, and welcome to Let's Chat. Excited about today's topic. Today's topic is prostate cancer. As many of you know, Father's Day is next week. Don't forget, if you are blessed to have your father living, I encourage you to celebrate them. In celebration of Father's Day month, we like to bring attention to those things that are concerning to our men. So if you're listening to this and you're a young lady and this is something and you're like, this is men, it doesn't relate to me, don't tune out just yet. Utilize this information for those men in your life that you love. Share this information because it is something that's important, as well as knowing that sometimes men are not the first ones to run to the doctor when something is wrong. So as the women in their lives that love them, sometimes we have to encourage them to go get things checked out. So this is information that will be pertinent for the men in your life that you love and care about. If you're blessed enough to have a father, I encourage you to have this conversation with him if you haven't already. And if you don't, as a family, discuss health needs, I encourage you, especially with what we've learned in the last year with the COVID-19 pandemic, to do so. Knowing your family history is so important. And a lot of times it's these conversations that prompt our loved ones to get some of the screening that they need in an effort to do what we love, which is prevent. We love to prevent disease. So that's why we bring you these segments of Let's Chat every Sunday, is that we're trying to prevent some things if we can, because sometimes if we know about things, we can do a little better, right? Right. So good afternoon, guys. So let's go ahead and get started. So let's talk about prostate cancer. What is prostate cancer? The prostate gland is a small walnut-shaped gland that is located near a man's bladder. It actually helps to secrete a liquid or fluid that's used to transport sperm. Okay, so that's what the prostate gland does as its function in our body. It helps to make a fluid that helps to transport and nourish sperm. Okay, so that's why it's important. Cancer of the prostate is a cancer of that cell, and what happens, a normal prostate cell turns into a cancer cell. There is a gene that typically is turned on when this happens in men. Okay, so let's just dig right in. Symptoms of prostate cancer. When it's early, there may not be any symptoms at all for prostate cancer, okay? So there may not be any symptoms at all if it's early. If it's advanced stage, the patient can present with the following symptoms. Now, I pause right here to share with you a lot of these symptoms. I'm primary care, board certified in family medicine, do urgent care. So a lot of times I treat patients that may have an acute need that they can't get in with their primary to see, and or I treat my primary care patients that come in with similar symptoms. The reason that I'm pausing to bring this up as I go over these symptoms, these are common symptoms that men sometimes complain of. So we have to make sure that we're kind of paying attention and listening to this part, ladies. So ladies and gentlemen, hopefully there are some gentlemen listening out there. So symptoms of advanced stage prostate cancer include, and some of these symptoms are similar to when someone has a benignly enlarged prostate, but just listen up, okay? Trouble urinating, frequent urination, decreased force of urination, difficulty starting or stopping their stream, blood in their semen, okay? So, unless if there are kids in the room, put something over their ears, because we're going to have a little talk, just a little bit, about something adult-like in nature. In terms of if your partner, husband, comes and says that they found blood in their semen, make them see the doctor. Encourage, not make them, but encourage them to see the doctor. It's very important so that you can check. It may just be a urinary tract infection, something very simple, fixed with antibiotics over a few days, no big deal, right? But if you see blood in the semen, very important to have that evaluated, because that can be a sign of advanced prostate cancer, okay? In addition to that, having bone pain and then having pain in the pelvic area. Okay, so let's go over that again. These are some vague symptoms that men will sometimes complain of. If you are out there and you are married or have a partner, you may have heard them complaining of these things, especially for older gentlemen, right? Because we know that as men get older, their likelihood of developing benign prostatic hypertrophy, which is a benign disease, is not cancer, but benign enlargement of the prostate tissue. Very common disease process, but benign. But a lot of times when patients present with that symptom, we have to differentiate. Is this BPH, which is what we call it, benign prostatic hypertrophy, or is this a chance that this could be prostate cancer, right? So when the patient presents with those symptoms, we go down our differential and trying to make sure that it's not that, okay? So again, symptoms of advanced stage prostate cancer. And again, these symptoms sound like common things when men, present with UTI symptoms, when men present with, a benignly enlarged prostate. Again, trouble urinating, frequent urination, difficulty starting or stopping their stream, a decreased force of their urination, blood in the semen, bone pain, and then pain in the pelvic area, okay? So those are things we're going to watch out for, so that if you're having those symptoms, gentlemen, please make sure that you see your primary care physician. Very simple evaluation, urinalysis, blood test, and we'll get to that in just a minute, okay? So those are the symptoms. Now, what are the risk factors? What are the things that happen that predispose us to having prostate cancer? Number one on the list is family history, okay? If you have a family history of prostate cancer and you're a gentleman out there, or if you're a woman out there and your husband, and if your husband doesn't know if he has family history of prostate cancer, help him find out this information, okay? Very, very important. If we know that there's family history, we know to start screening in that patient earlier, right? That earlier it is caught. And prostate cancer is a disease process that the earlier that it's caught, the better for the patient, okay? We have various treatment modalities, some great urologists, especially here in the city of Birmingham, that are able to treat this disease process, and it makes a huge difference in not having an advanced stage of prostate cancer. So, family history. Number two, increasing age. As men get older, the risk factor for prostate cancer increases, okay? So we want to make sure that we do those evaluations up until the age of 70 years old. We're going to get to the PSA in a minute and those age differentiations. Third risk factor, and this may or may not surprise some of you. So we've got family history as a risk factor. We have increasing age. Guess what number three is? Obesity, or being overweight, okay? So all of those things are risk factors, or things that increase your likelihood of having prostate cancer. So when a patient comes in and they have these symptoms, or we're concerned about them having prostate cancer, what do we do, or when do we evaluate it? Number one, this is something that you should discuss with your physician every year at your annual exam, whether or not you need a PSA. We definitely start it at the age of 40 years old. So from 40 up until 69 years old, we'll do a blood test that's called a PSA. This is a gold standard recommendation of screening for prostate cancer, and it's a blood test. Men that are at least 40 years old take this test, people that are not at risk, and those people that are at higher risk. So let's talk about some of those people at higher risk, right? So number one, African American men have the largest concentration or percentage of prostate cancer of all the other cultures in our country, okay? So this is a disease process that's very common in African American men, especially as they get older. Number two is family history. We've already talked about that. Number three is taking medication that helps to shrink or reduce the size of the prostate. A lot of times when patients have an enlarged prostate, we'll give them medicine that helps to shrink the prostate or have it not be so enlarged. When the prostate is enlarged, and I know we're not talking about BPH today, but just to hit that just a little bit, when the prostate is enlarged, there's medicine that we give you that helps to shrink it. But when it is enlarged, sometimes you have difficulty emptying your bladder or having urinary symptoms. That's the most common symptom with BPH. So that's another risk factor. And then fourth risk factor, or fourth thing that puts you at higher risk, is having a PSA that is greater than 1. So let's say you do an annual exam with your primary care doctor and they say, okay, your PSA is normal, but it's 1.0. So that puts you at risk. So you're going to be someone that we want to make sure you get that PSA every year. Okay. If you have a question, oh, should I be doing this every year? You know, I am a bit aggressive when it comes to screenings with my patients and making sure that we're screening for all the things that we need to at the right time. I think that most physicians are not trying to differentiate there, but what I am saying it is that it is important to stress with your patients, and this is more so what I mean, the importance of these annual screening tests and their relation to prevention of cancer or catching it early. Okay, so that's the PSA. It's a blood test. Now, there are various other modalities. There's a digital rectal exam, there's an ultrasound exam, and in addition to that, a biopsy that takes place if your PSA is elevated, or if on digital rectal exam you find, you know, a bump or something hard or firm, something that's concerning. Okay, and that's done with the annual exam as well. So let's talk about preventing prostate cancer. What can we do to prevent it? Because that's what we're all about, right? We love to help prevent disease processes if we can. So prevention, number one, is following a diet that is healthy in fruit and vegetables, okay? That will decrease the likelihood or risk of prostate cancer because you're giving your body healthy fruits and vegetables versus a diet that's bad that puts you at risk for health issues in relation to both directly and indirectly to obesity, which brings us into the next thing that you can do to help prevent prostate cancer: having a regular exercise regimen, which in turn would help with weight loss if you were someone that was overweight. Next thing, cutting down on fatty foods. That again leads back into obesity and us making sure that we are not continuing to take in foods that are going to put on pounds or put on weight, but cutting down on fatty foods. That's another way to help prevent prostate cancer. In addition to that, remaining physically active. If you're someone, and let's say that, you know, it's your dad or your uncle or someone and they've retired. If they've retired from work, no problem. Let them enjoy their retirement. However, they do need to make sure that I encourage my patients that if they are physically able to, they need to remain physically active. Remaining physically active as you get older has shown in studies to decrease the likelihood of disease processes such as cancer, as well as heart disease as well. So maintaining physical activity, very important. And then lastly, avoid smoking and avoid alcohol. Okay, so preventing prostate cancer, 5 things. We're going to watch out for our diet, eat healthy fruits and vegetables. We're going to cut down on fatty foods. We're going to maintain a regular exercise regimen, stay physically active, right? And we're going to avoid smoking and avoid alcohol. Those are things that will help prevent prostate cancer. So let's see if we have any questions here. Does anyone have any questions? Hi, Miss Meadows. How are you? Thank you for joining us. Hi, Miss Jones. How are you? Hey, Danielle. How are you? Does anyone have any questions? Anyone have any questions? Any questions at all about prostate cancer? Again, this is a disease process that's very concentrated in the African American community. Sometimes men are not as forthcoming in having these conversations. I encourage you, as the women in their life and the women that love them, to have these conversations with them. Encourage them to go to the doctor. Go to the doctor with them. If it will help them get there to get that annual exam, I encourage you to go with them. You know, help them have the conversation. Sometimes people are, in different places in life, right? So sometimes people are challenged with having that conversation with a physician, discussing some things that, may make you uncomfortable, to talk about your urinating and in their genital area, and or issues or a hesitation to talk about how it may be affecting them even sexually, right? And so if you can go with them to help them have that conversation, please do. If this information has been helpful for you, please share it with someone that you love and care about. Does anyone have any questions? Anyone have any questions? Okay. So if you do have any questions now, I want to encourage you, if you have any questions, tomorrow on CBS, we'll be discussing tick bites. So if anyone has any questions about tick bites at all, Well, actually, any medical questions at all, you can actually send those questions to us. But tomorrow's topic is tick bites. So join us tomorrow, and I think tomorrow's show is actually going to be a little early at 6:15. But if you have any questions about those, please email those to us at housecalls@cbs42.com. Housecalls@cbs42.com. I hope everyone's having a good day. It is extremely hot and humid outside. I was outside for a bit yesterday, for a long period of time, actually, and got a chance to see just how humid it is outside, because I haven't sat outside for that period of time since it's been humid. Probably, I'm always in and out working and such. But please make sure that you're hydrating. It is extremely humid and hot outside. Make sure you hydrate before you go out, while you're out there, and then when you come back in. Okay? Hey, Dr. Carolyn, thank you so much for joining. Hi, pretty Barbie. Thank you. Happy Sunday to you too. Does anyone have any questions? And again, please, we want to hear from you. Any medical questions you have at all, please, you can always email us at housecalls@cbs42.com to have those questions answered. If you're in need of a COVID vaccine, definitely give us a call. You can give us a call here for a primary care appointment, as well as to get COVID testing or COVID-19 vaccine. That number is area code 205-291-8842. That's all we had to share with you guys. Pretty Bar, she said, I got her second shot this past Thursday. Yay, congratulations. So that means by the 24th, June 24th, Pretty Barbie, you'll be fully vaccinated. Yay! So excited for you. So excited for you. Oh, thank you, Miss Meadows. I will take those blessings all day long. Thank you so much. And you're welcome. We are delighted to try and bring health topics to you, to just try and help. We're about prevention and trying to keep everybody healthy. Okay. Oh, Miss Meadows, you're fully vaccinated. Yay. I know that you're so excited. I know that you are. And I encourage you all also, if you are listening and you're not fully vaccinated, I want to just share this with you, as well as if you're out there and you're fully vaccinated, please make sure you share this with your family or friends or what have you. If you're not fully vaccinated, you should not be behaving the same way that someone that is fully vaccinated. The reason that I bring that up is because of a lot of the things that I've seen over the last couple of weeks, being out at the store in different places, and a lot of the questions that I've gotten, as well as some of the patients that we've seen. You have to remember that you have to protect yourself. Remember, you don't have immunity if you're not fully vaccinated, right? If you've recently had a COVID infection, you may have immunity, and we know that that lasts anywhere from 6 weeks to 3 or 4 months. Everyone's different. And the only way that you would know that is to check your blood levels throughout that period of time to find out, hey, do I have antibodies? You are not protected the same way that someone is fully vaccinated. So all the things that we were doing before to be careful about getting COVID-19, I encourage you to continue to do those things. And remember that as you move about the cabin and are socializing, etc., with other people. I do understand and know that, different people are having different philosophies. There's so much surrounding the vaccines. But I want us to remember these basic things. Remember where we were a year ago, guys. Don't forget that. Don't forget where we were a year ago. And remember, we're not trying to go back there. But again, for those people that are not vaccinated, please make sure that you remember to protect yourself. And please make sure that you're continuing to mask when you go out and are around other people. And especially if you have relatives that are older in nature and they're vaccinated and you are not vaccinated, I just caution you there. Just recognize and realize that you're not vaccinated, which means and remember, 30% of people, 30 to 40% of people positive with COVID don't have symptoms at all. Okay. So we need to remember that. Okay. So remember that if you go visit your grandmother, right? Or your aunt or your uncle or someone that has autoimmune issues. So that means we need to be masked and taking those precautions, 6 feet and all of that. So that's all. I'm not going to go into COVID talk at all. Today was about prostate cancer, and I hope we remember those things. And just remember one last time, if you or a gentleman and you're out there, or if any gentleman that you love and care about is out there, or any gentleman that you may not love or care about, you may just be a friend or something like that. Just remember, if they complain of these symptoms, make sure that you encourage them to see the doctor. Any issues, trouble urinating, trouble starting and stopping and starting stream, trouble forcing stream, frequent urination, blood in the semen, bone pain, and pelvic pain. Okay. And you can have one or all of those symptoms, or one or a couple of those symptoms, but we just want to make sure that you get that checked out, especially the blood in the semen. That's something that sometimes people will give it and say, oh, it's nothing, it's nothing. No, let's go ahead and get that checked out. Okay. Okay. No, Miss Jones. Oh, she asked the question. Oh, Miss Jones, you're going to make me go there. If you're fully vaccinated, do you still have to wear your mask? Okay. That's a full question, Miss Jones. So the short answer to that question is it depends on where you are, right? If you are going into work or you're going into a meeting and you are vaccinated fully and that other person is vaccinated fully, then I would remove my mask. If you are fully vaccinated and let's say, it depends on the environment. If you're fully vaccinated and let's say you're going to go to Walmart or you're going to go to the pharmacy, those are places that you're going to have a larger number of people that could potentially be non-vaccinated. You don't know everyone's vaccine status because you don't know their status. I would encourage you to wear your mask. If you're going to dinner, or let's say you're going to a dinner party, and let's say it's 8 people, 4 couples, and let's say everyone's vaccinated except one person in the room, you can take off your mask if you're fully vaccinated, right? Let's say you go to a dinner party and let's say that you don't know how many people, let's say you go to, I don't know, a crowded, the only thing I can think of is a bar. Let's say that you go to a crowded bar or something like that. Would you wear your mask? If a large percentage of people, 100 people or so in there, 50 even, and it's an enclosed space, what you have to think about is where you are. If you're in an enclosed space where there is not good ventilation, I would be masking. If you are going to a space, let's say you're going somewhere outside at a concert or somewhere, do you have to wear a mask? You probably don't have to because you're outside and it's, full ventilation. Compacted indoors, you do need to think about whether or not that other person is vaccinated and or they're having symptoms. You should be protected because you're vaccinated, but it's just a question of what level of comfort that you have. The CDC has said that fully vaccinated people do not have to mask when they go out into public, but are encouraging you to consider certain situations wherein if you're going into, I'll give you an example. If you're going to go fly on a plane, I encourage you to wear a mask because you don't know everyone's vaccine status on the plane and you're in a compacted, area, right? And I'm not even sure if they will allow you to not wear a mask on a plane yet. I haven't had that interaction or had that question, an updated question, I'll say, about that yet. In the last probably week or so to know what it is the airlines are doing. But so the answer to the question, Ms. Jones, it depends on where you're going. You just kind of have to think about the environment and who it is that you're going to be around. Does that make sense? I hope that helps, and I hope that makes sense. Ms. Meadows says, I continue to wear my mask in public due to not knowing the status of the crowd. Just want to be safe. Exactly, Ms. Meadows. And masking is a safety measure for her and her family. Wonderful. And that is amazing because what she has said is true, because that's what everyone should be thinking. Because what you have to remember is, and unfortunately, and the report has shown there about 40% of our state is vaccinated. We're like on the low end. I think it's Alabama, Mississippi, I want to say Louisiana. I just read an article about this last night, and I can't remember the other state, but I know it's Alabama, Mississippi, and I think Louisiana had lower numbers of percentages of the population that were vaccinated. And so therefore they're predicting that in those areas is where we may start to see issues with COVID in the next couple of months or by fall. There's no way to predict what that is. I encourage you to do what you need to do to continue to help keep your family healthy. Remember, do you all remember when Mayor Randall Woodfin passed the mask ordinance in Birmingham, Alabama? It was an unpopular decision and move. Kudos to Mayor Woodfin, because that was the right thing to do. Because immediately, and that was part of the reason why initially a lot of the numbers were decreased in Birmingham when it came to COVID cases, and higher percentages outside of Birmingham initially there were. As the mask became a mandate, remember, we saw the numbers go down. That's because the mask helps to protect and prevent respiratory droplets from spewing out into the environment, right? So now fully vaccinated people can move about the cabin without a mask because they're fully vaccinated. Because when they come into contact, and this is the best way, you know what? I forgot this little scenario because I did this for a patient on Thursday. Best situation I can give you is this. So if we know that COVID is passed through respiratory droplets, right? So it depends on your level of, how much exposure that we have, but we do know definitively that when we wore masks, the percentages of COVID cases went down. So if you're someone that's fully vaccinated and says, hey, you know what, I want to be really aggressive about this, especially because I don't know the status of other people that I'm moving about the cabin with. I don't know what their status is. So if you want to be aggressive, continue to mask. I personally feel like that is fine. I encourage my patients to do just that. Especially if you have a history of heart disease, you have a history of diabetes, you have a history of vitamin D deficiency, if you have a history of obesity, if you have a history of high blood pressure, have a history of any kind of chronic lung disease, any kind of chronic renal disease, any kind of chronic respiratory issue, most especially asthma and COPD. I strongly encourage you to continue to do that to keep you and your family healthy. I encourage you to also help your parents or grandparents or people that are 65 or older. They have a decision to make, how they're going to move about their cabin, who they allow in their cabin, how they want to deal with their family in that setting. And what I encourage them to do is make sure, if you know that you have family coming over and you all as a family have decided, okay, we know that part of the family is going to be vaccinated, part of them are not, and you all are still going to get together, then you all have to make a decision about the mask requirement for your event or venue or what have you, and or encourage everyone for the protection of grandma, or for me would be Medea, which is what my grandmother's name was. So if my grandmother were living, what I would be doing is saying, okay, we got to make a decision. So if you want to visit Medea, we got to go through these things. And remember when we used to require people to have COVID tests, a negative COVID test, and this is still a requirement for travel, but a negative COVID test before you could come back to work, before you could do, other things. That also is an option if you're having a family get together, saying, hey, we're going to need you guys to get a COVID test and quarantine, and still making sure that they mask. That would be taking extra measures to help keep everyone safe in that capacity. Does that make sense? I hope that makes sense. So hopefully that was helpful. I didn't mean to go on and on about COVID or the mask wearing, but that part is important. So I hope that was helpful. Hope so. I encourage everyone to be safe. I also further encourage you to continue. Don't forget all the things that we did to bring us to this point and to help protect us during the COVID-19 pandemic, which would include and not be limited to the mask wearing, the social distancing, washing your hands as frequently as possible, taking off your clothes and everything from the outside environment before you, sit down in your house and do all of those things, making sure that we are eating good meals, making sure we're drinking plenty of water to boost our immunity, making sure that we're using vitamin supplements to help support our immune systems. All those things are very key to help decreasing the likelihood of spread of COVID-19 and helping to keep you protected, even if you're vaccinated. Remember, water, vitamins, exercise, okay? All right, I hope that was helpful for you guys. Sorry that lasted a little longer. We got off on a tangent talking about COVID, but hopefully that was helpful for you all. I hope you have a happy Sunday. Get outside, get some vitamin D, but take your water with you before, during, and after you leave. Okay? Have a good day, guys. Bye-bye.